There's a patient who had a Symfony lens put in his left eye 3 years ago. He has some PC opacity in this eye and he's bothered by halos and glare. The other eye received a Puresee lens just a few weeks ago and he prefers that lens because it gives him the extended depth of focus he wants without the halos and glare. So here in the left eye, we're going to go ahead and exchange the Symfony lens that's been in for 3 years for a Puresee lens. And we're also going to try to clean off the posterior capsule so he doesn't need a YAG laser capsulotomy. So here I'm going to go ahead and start visco-dissecting the capsular bag open. This is with a LASIK cannula and dispersive viscoelastic. This video is being shown at normal speed with very little editing to give a sense of all the steps that are involved in this lens exchange. Now, even though this lens has been in the eye for 3 years, once you reopen the capsular bag, it's really not that difficult to extricate the lens safely and exchange it for a new lens. So here we've initiated the reopening of the capsular bag, and now I'm going in with cohesive viscoelastic on a 27 gauge cannula, and I'm going to go ahead and start expanding the capsular bag from different angles and different directions. You can see that the capsular bag is fused beyond the optic, and the goal here is going to be to try to gently viscodissect this and separate the anterior and posterior capsule without damaging either. So here I'm working my way around and separating the anterior and posterior capsule. And now I can see that the lens is starting to give a little bit. It's starting to become mobile. And I think I can start to take this out of the capsular bag. I'm going to go ahead and retract the haptic out of its tunnel. There's a fibrovascular tunnel, and I can rotate this out. And at this point, I really am very comfortable that it's going to be an atraumatic extraction of the lens. So I've got one side up out of the capsular bag, and now the other side dials out into the anterior chamber pretty easily, and the lens is completely freed up. So now I'm going to hold the lens with a micro holding forceps and cut it in half using a Packer Chang 19 gauge scissor through the main incision. The lens cuts relatively easily. You can see I'm holding the lens securely in my left hand as I cut the lens with the right hand, and I've worked my way completely through now. These lenses are a little bit sticky or tacky, so I have to extricate that from the forceps using the other hand. Now the first half of the lens is going to be pulled out, and as I do this, I protect the back of the cornea with a Symfony hook. I'll grab the second half of the lens and rotate this a bit and pull this out through the main incision while I protect the back of the cornea again with a Symfony hook. So now the lens has been completely removed, and I'm going to use a 27 gauge cannula with BSS to power wash the lens epithelial cells off the posterior capsule. This posterior capsule opacity is really lens epithelial cells that are proliferated on the posterior capsule, and I'm able to irrigate most of them off. And now I'm going to use the irrigation aspiration handpiece on a polish mode to vacuum off the rest of the lens epithelial cells as much as possible. And you have to be careful here because you don't want to rupture the posterior capsule, but I'm being very gentle and just sort of sweeping and stroking on low suction here to try to vacuum the posterior capsule as clear as possible. And I'm actually very successful. The capsule is really starting to look nice and clear, and if I do this, I may be able to avoid a YAG laser for this patient. So we go ahead and complete the posterior capsule cleanup, and it's starting to look pretty good. You don't want to be too aggressive doing this, but I feel pretty comfortable that I'm going to be able to avoid damage to the posterior capsule here. The suction is very low. And once I think that the capsule is about as clear as I'm going to get it, I'm going to come out of the anterior chamber with the eye in a handpiece and inflate the capsular bag with viscoelastic so I can put the new lens in. So I'm just about done with the posterior capsule cleanup here. And now I'm inflating the capsular bag with viscoelastic. And this is the new lens. This is a 16 diopter Puresee lens that's going to go ahead into the capsular bag. And it'll unfold, and I can tuck this under the anterior capsule completely and dial it into position very gently. And once this is completed, um, I'll remove the viscoelastic from the anterior chamber using the irrigation aspiration handpiece. The lens centers very nicely as it unfolds. And now I can remove the viscoelastic. Once this is completed and the lens is in good position, I can make sure that the incisions are completely sealed and the case is completed. Thank you for your attention to this case.